This is Michael Patterson discussing a cataract surgery that has a premium intraocular lens. This is just a normal cataract surgery. I start with always a double diamond technique. My dad taught me that with a guarded diamond blade that's completely dull on the sides for your side port. You don't need any stabilization instruments when you do that, and just a 2.75 millimeter keratome. Typically, my cystotome comes loaded with BSS. And so when they hand me that, I irrigate the cornea myself. We do a cystotome capsulorhexis, and we try to avoid using Utratas just because our viscoelastic is OcuCoat in this instance and will come out of the eye with a larger instrument in the eye. Once we do the capsulorhexis, we go in and do some hydrodissection, one big fluid wave with a nice golden ring, and then tap the nucleus down and slightly rotate it. This is the Stellaris Phaco platform, which has a Venturi vacuum-assisted phacoemulsification. I typically go in with a direct horizontal chop, immediately use my chopper to grab pieces and slice the nucleus with the phaco tip aspirating nuclear quadrants. Due to having a good hydrodelineation, you can see that the lens comes up nicely and leaves a nice epinuclear shell that will come out at the very end here. Once we do the phacoemulsification, we then run through with irrigation aspiration. As I get the assistant to load the eye handpiece, we'll typically start at the biggest piece we see. I don't usually go to subincisional first or last, just whatever I can find. I use a curved tip irrigation aspiration handpiece, and I think this makes it a little bit easier for difficult pieces to remove. As you can see here, having trouble I like to do a little bit of polish under the capsule here, especially for premium lenses, and you can see here I've got it already on polish, and I'm using the eye handpiece, which will do a great job of removing all cortical debris. At this point, I'll fill the capsular bag and use the OVD cannula to polish the posterior capsule. I'll place the lens without a second instrument into the bag using the injector itself. I'll keep dialing it to push the lens into the bag, and you'll see here the lens will slowly unfold. I go ahead and introduce the irrigation aspiration handpiece and use it to maneuver the haptics off of the lens. Some of the acrylic lenses will slowly unfold, and this is no different than any of them at this point. You can see here I'll remove viscoelastic from the anterior chamber, assuring good adequate removal underneath the optic. Always go underneath the optic of the IOL with the eye handpiece just to make sure we have all the viscoelastic removed, especially on a lens that the position is absolutely imperative. Remove the eye handpiece, and then I'll hydrate the wounds gently. I don't like to do too aggressive of a hydration, just enough to make sure the eye is firm. You can see there it's completely firm. And I will then place an antibiotic and clear steroid mixture in the anterior chamber. I will use a Wexel to check the wound. And then at the very end here, I'll use a subtenon Kenalog that I use, as my patients don't use drops pre or post-op. And you'll see here just a nice injection, and that's the end of the case. Thank you for watching.